Hi, I'm Dr. Robert Lowen, a board-certified and real self-verified plastic surgeon in Mountain View, California. This is how to tell if you're an ideal candidate for a tummy tuck. We'll be viewing videos of real women who are interested in having a tummy tuck to see if they have the right body type to achieve ideal results. And then we'll share what you need to know if you're interested in having this procedure. Let's get started. So what is a tummy tuck? A tummy tuck is a surgical procedure to remove excess skin, excess fat from the front of the abdomen, and tighten the muscles to get a flat stomach. It also incorporates liposuction if there's excess fat of the abdomen, waist, and flanks. If the question is why do women want a tummy tuck, the answer is clear. They want their body back. After having children or having weight gain or loss, there's excess skin that cannot be reduced with liposuction alone. The muscles are not functioning properly because core integrity is lost by spreading of the muscles apart. And there are problems with wrinkling, stretch marks, and these problems can only be resolved by a surgical procedure which removes the excess skin, tightens the abdominal wall, and eliminates the unwanted fat. I've been performing tummy tucks for over 30 years. Over the years, I've concentrated on solving the problems inherent in getting the ideal results. We start with the most important thing that concerns women the most, which is the incision. This incision is a trade-off, but every effort is made to hide it, so it can't be seen even in a bikini. And then we want the flattest possible tummy, and we want also to remove just the right amount of skin, and we want to make sure the beauty of the underlying torso is revealed by appropriate liposuction.
Hi there, my name is Casey Megan. I am 37 years old and I live in Los Angeles, California. I am interested in a tummy tuck procedure because for me, my weight has really vacillated and shifted over the years. I have really worked on my weight loss journey. At my heaviest, I was about 176. I've gotten down now to about 150. But for me, eating right, exercising, doing all the things that you need to do to kind of like get your body into tip-top shape, I'm still at this point where I haven't reached my end goal. And I know that as I am 37, there's only so much more that I can do and that time will allow me to accomplish before, this is where I'm going to stay. And so I think that is the reason why a tummy tuck procedure really kind of fits into my life, especially being someone that hasn't had children or plans on having children. I know that this procedure is a right fit for me and it matches the aesthetic that I'm looking for.
Casey actually is a candidate for a tummy tuck. She does not appear to have a lot of excess skin. She hasn't had children, there are no stretch marks. But what seems to concern her is the fact that her abdomen is lax, and that is not going to be corrected with either liposuction or further working out. It can be improved, but if she really wants a tight, flat abdomen with some muscle definition, she'll have to have that looseness repaired. That's a tummy tuck. Now, it'll be a certain kind of tummy tuck. We won't be trying necessarily to take out a lot of skin, and she still will have to have an incision, but we can lift everything up, repair the muscle, tighten it all up, pull it down, take out any excess, and she'll be very happy having achieved that goal. Any liposuction that's needed can be done at the same time. We want to make sure that your abdominoplasty scar is not visible, even in a string bikini. And how do we do this? Well, it's logical that if you close the top to the bottom under tension, when you close the incision, it's going to pull it up. So if you leave any laxity underneath where you made the incision, it'll pull the incision up and it'll be visible. So we prevent that by having the patient pull the lower abdomen up as hard as they can, but comfortable. Put on the bikini, mark the bikini, flex the thighs so the bikini goes right in the crease between the torso and the thigh. And when you make your incision underneath those markings, it will never be visible. It can't go up because it's already been pulled up and it can't be pulled up anymore.
Hi, my name is Lisa. I'm 53 years old and I'm located in Los Angeles, California. And I am interested in having a tummy tuck. My belly is a little bit hanging over from having 3 C-sections and the rest of my body is fit, but I would like to have that flat stomach that I had before I had my children. So I just wanted to know if I was a good candidate.
Lisa's had 3 C-sections, so the scar is tethered to her abdominal wall and the loose skin above it falls over. This is a common concern, and If there's just a little bit of extra skin, you can have a mini tummy tuck, or really just a mini lower abdominal skin removal and scar revision. But a tummy tuck is designed to work on the underlying structure. Lisa has an enlarged abdomen, she has laxity, she has a lot of loose overhanging skin. She needs a repair from the top to the bottom. That all has to be brought in. All the excess skin, and there will be more when the repair is done because it'll hang straight down, has to be removed. So when that's removed and her abdominal wall is tightened and her waist is narrowed, she'll look great. The C-section scars are always removed. The incision always goes below the C-section scars. Results for a tummy tuck can last forever. Now, if you gain weight, obviously it won't look as good as it was when you first started. But I try and make sure that the muscle repair, the flat stomach, is very long lasting with a multiple layer closure done in a very specific way to get it tight at the beginning and make sure it stays that way.
Hi, I'm Delilah Georgette. I'm in Colorado and I'm 41 years old and I'm interested in the tummy tuck procedure. I've had 2 kids. I've had 2 C-sections. Throughout my pregnancies, I gained a lot of weight. So there's a thick layer and loose skin on my lower abdomen. There's scar tissue from the 2 C-sections. I work out every day, do martial arts. I have a very strong core. I know that there's muscles under there and I just can't see them. I'm not quite sure if I am done having kids. And so my question is, in regards to that area, is there any internal damage when the procedure is done? Should I wait to have the tummy procedure until I'm done having kids?
Well, Delilah is the type of patient that I see all the time. The only difference is that Delilah hasn't decided yet whether she's going to have more children. So I would say the answer to that is obvious. If you think you may have more children, don't do a tummy tuck, just wait. She's still in the young childbearing years, so there's a good chance she will have another child. But after that, then even if she has another C-section, there's no problem at all in taking care of all these concerns. She's got excess wrinkling skin, she's got stretch marks that are in the lower abdomen, which almost all go away. She has excess fat of the abdomen and the waist. And I guess if we looked at her from the side or the back, we'd see she has some love handles too. All of that would be addressed. This patient mentions that she is a very active exerciser. She has good strength in her abdominal muscles, but she can't see them. Well, once you do the liposuction and tighten the muscles to restore the anatomy, a great deal more definition would be apparent. I'm frequently asked if I should lose weight before getting a tummy tuck. So if the question is how to prepare, one should have a weight that is reasonable, but you don't have to lose 20 pounds in many cases, as some women feel that they do in order to have a tummy tuck. I've operated on patients with BMIs of 30 and above, and the excess fat around the torso is taken care of by the liposuction. So if you lose 10 or 20 pounds, it's not going to make much difference. So to prepare yourself, just be in good health, obviously not dieting strictly ahead of time, and discuss what your expectations are. If your ideal is to have treatment of the torso, the abdomen, the waist, the flanks, the bra rolls, then you don't have to wait to lose another 20 pounds necessarily. But I do like to operate on patients whose BMI is 31, 32 or less, although I sometimes do larger. When patients are properly prepared, they're in good health, their health history is normal, they're a low-risk patient, it's very unlikely that there will be postoperative issues related to their health status. There's always a risk of an infection of the skin. You just keep an eye on the patient, and if something comes up, you treat it. If you're trying to find the best doctor, first of all, get a board-certified plastic surgeon to do it. That's number one. Now, when you're trying to narrow the field among board-certified plastic surgeons, you probably will want to find someone who's doing mostly cosmetic surgery and has a lot of experience in tummy tucks. Tummy tucks are not an easy operation. They're a complex operation. They require multiple steps. Some doctors try and do them as fast as possible, other doctors don't. Some do drainless, some don't. And then you have to find someone who's confident in doing it. You want to see before and after pictures. You want to see if there's consistency in the scar being low and not visible, and that you have a nice repair of the abdomen. Are you interested in having a tummy tuck? Find out everything you need to know about having this procedure on realself.com. Thanks for watching.